Dr. Heather Davis, I met you at the Great Veterinary Conference, and we were just going to talk about cats with hypertrophic cardiomyopathy, which is a big deal. My own vet said it's the only thing I want you to come back and tell me more about because it's such a big issue for cat owners and for vets. But you work for a company, PRN, doing a much bigger kind of umbrella over many species and many products. Can you talk a little bit about who you are as a vet? Because I think it's really interesting to the vets and vet techs listening, but also to lay people, or I hope there's young listeners who think, oh, that would be a cool career for me. So, how did that happen? You were an equine surgeon. That was your specialty.
It was. First of all, Tracy, thank you so much for having me. It was such a pleasure to meet you down at VMX and even a greater pleasure to be here this morning with you. So, yes, so I grew up on a ranch in Arizona. So I had everything from cats to horses to dogs. And I fell in love with veterinary medicine and went on to get my degree and then become specialized in equine surgery. And I was teaching at Auburn University for many years, both pharmacology and equine surgery. And then I came to work for PRN PharmaCal, and we develop drugs for dogs, cats, and horses, as well as commercializing them out in the field. And so I've been really fortunate because we're a really small company. We're employee owned. And so I get to work with veterinarians that help bring drugs to market and to the underserved areas of practice. And then I get to work with veterinarians that are out in the field with their colleagues, teaching them about new products that we launch. So I'm really fortunate in what I get to do.
And they're fortunate to have you because you are an energy bomb. You're so full of good spirit and energy and positivity. And I think what's interesting about your company, PRN, and I can say your company, I didn't know was employee owned. That's so attractive, that idea. Oh, there's not some big corporate monster. It's us. We're the docs. We own this joint. But it's that you're developing products for underserved issues like these kitty cats who have heart problems. 1 in 7 cats develop this problem, and there hasn't been a treatment. So I think it's amazing that the vets themselves, your colleagues, say, what could we develop that no one else has spent time on it? I don't think it's like orphan kind of problems in the cancer world where people have these rare cancers and no one's developing a treatment. But maybe it is a little bit like that, is it?
It is. It's more, it has to do with size. So we look for areas that larger companies aren't developing in and areas where practice really needs it. One of the benefits of being employee owned is the fact that we're held accountable to each other. And so every dollar we spend in research and development, I'm held accountable to the individual that shows up every day to make our products. And so it keeps you really honest. It's the closest thing I've ever found to veterinary practice, but it also keeps us in, let's really go after the areas that we know veterinarians need. And Felicin CA1 is a perfect example of that. It's been a disease process that we knew kitties had, but because cats are cats and they're the masters of hiding their disease processes, and in fairness to veterinary practice up until now, we didn't have anything that we were only treating the symptoms. We weren't treating the underlying cause. And it's a really exciting time for us as veterinarians to look at feline medicine as a whole so that we become better partners and as far as for them as patients and their caregivers.
As I said, my vet really did say that's what she asked. She said, I've heard there's this new Fellison CA. And I was like, okay. And then I found you, or you found me, because I think also your company is of great interest to me because it does these niche products that are desperately needed, but they're not attractive enough to the giant pharma companies. Look, can you talk about this disease and how an owner might, because it's for subclinical,
Mhm.
right? It's before it becomes so full blown as a heart disease that there's no going back, there's no fixing it. How do we know that we know all cats are prone to kidney disease.
Mhm.
Now we also know they're prone to cardiac disease. But this disease, cardiomyopathy, hypertrophic, you have to say all the words, otherwise not specific enough. There,
Right.
a lot of them are prone to it. Is there a way that an owner should keep a sharp eye?
For sure. I think it's number one, being aware of what kind of kitty you have. If you have one of those specialty breeds, like a ragdoll or a Maine Coon that we know are more predisposed to it, it's opening that dialogue with your veterinarian and saying, "Hey, I know that I have this kitty in my household that I'm taking care of, and depending on what life stage it is, what can I do to prophylactically keep an eye on it and do the right thing at each life stage, and looking at whether or not do you want to genetically screen some of the breeds they offer when you purchase the, go ahead, I'm sorry.
No, wow, that's amazing. You can genetically screen for this.
Some of them, yes. And I've developed some markers, but otherwise, just starting that dialogue as far as with your veterinarian prophylactically, and saying, hey, I want to know more when they're young. I think for many years, we just vaccinated kitties and made sure that they were okay. That's when we could get them in the cat carriers to go to the clinic. And so we have to now, in the year of the cat, we have to change how we look at them and really listen to them as much as we're listening to the caretakers. But identifying what stage of life they're in so that we can screen things, because there are some blood work that we can check. There's some physical exam findings that we can do in the clinic to track that as the cat progresses so that you catch them. Because subclinical basically means that the cat's going to look completely normal to you
Yes.
when they're at home, and you're not going to know anything, which is scary because in that cat's life, in some of these hypertrophic cardiomyopathy cases, the cat is fine, and then something really traumatic happens, and then it becomes very traumatic for the cat, and it becomes very traumatic for the caregiver. They can have thromboembolism, they can have go into congestive heart failure and have sudden death. And the sooner
Wow.
that we can identify that there's something wrong, and it all starts of looking at your kitty and saying, okay, how old are you? And then let's open that dialogue with the vet. One of my favorite things to tell owners, though, that what you can do is the sleeping breathing rate. And
You
that is
told
something
me that, and I
I
thought that
know.
was so cool. It's
And
like
it's
you can take control without a stethoscope, without a medical degree. You can just observe
And how many, I bet you if you opened your phone now, how many pictures and videos do you have of your cat? You
a
probably
lot.
quite a few. And so while they're sleeping, get a video and record it. And you can record it for a full minute. And then you can count how many times that cat breathes in the course of a minute. And what we have found is that if it is less than 30 times in a minute, then the cat is probably normal or less likely to be developing clinical stages of congestive heart failure. So without even listening to them, if you find that your kitty is 10 or 12, then that's great. But the closer they get to 30, the more you need to be concerned. And so you become a very helpful source for your veterinarian by monitoring that at home. Because obviously cats behave differently at home than they do when
Yeah.
they're at the veterinary office. And so as much as a partner that the owner can take as far as to help that veterinarian out is very good. And then grabbing a video, save it to your phone. And when you're in the clinic, showing your veterinarian, hey, this is the resting heart rate, or I'm concerned, and just being willing and vulnerable to share that. And the vulnerability goes both ways. The veterinarians, now that we have something that we can manage the disease with, we have to pivot as far as how we are treating cats too, and be more aware and conscientious as far as listening to what the owners are saying.
Or encouraging the owners to pay attention. So if
Yes.
you're a veterinarian and the person has an 8-year-old, and you're saying that some of the pure breeds are much more susceptible to this heart condition,
Yeah.
is it like a long laundry list, or can you off, not to put you on the spot, but should we not get rag dolls unless we can't live without one? Because the cats
No,
in
I
shelters
think
are purebred. Also adopt purebred cats.
yes, exactly. I think so there is a laundry list. The laundry list for the Maine Coons and the Ragdolls, the genetic testing is available. For
Oh,
other ones, it's just more likely that we have found that there's an increased prevalence. And so I think we have to be careful because you don't want everybody to freak out. Oh my gosh, I have this purebred cat. It's one of those things that if you do have a purebred cat, it's most notable about, okay, I probably need to be a good partner, and realizing that getting into the clinic to have some basic baseline things taken to make sure, or to get a baseline to assess where we are in our life stage, will help, because then we do know in those purebred cat lines that it's a greater propensity. And so the sooner you can just make that decision that you want to make sure that you're getting in there to get full blood work. You want to get an NT pro BMP, and then have the veterinarian listen to the cat and see if there is a murmur present, but also if they can get a blood pressure. But that also, in those three things that you're doing, helps you rule out other things that the kitty could have. And even though I'm here today to talk about hypertrophic cardiomyopathy,
right.
that's a really good, those three things are pretty straightforward on what the veterinarian can do to give you a really good idea of where the cat is as far as on its general health as well.
That's a really good point. And the nice thing now is that for the first time, you aren't just saying, come in, pay an exam fee, put you and the cat through the stress and the sweaty upper lip of, oh my God, the cat, the carrier. I'll use pheromones. I think you guys also have some great anti-anxiety drugs at PRN, but we'll discuss that separately. And then what's the point? The point is you now have developed a drug that not only treats it, but stops the progression of the heart disease, right? The
Right.
Felicin CA, it stops the heart disease from progressing.
Mhm. Up until Felicin CA1, when veterinarians diagnosed hypertrophic cardiomyopathy in cats, what happened was then they had to start a very difficult conversation with the owner. As
Yeah.
far as, I appreciate there is something wrong with your cat, but now we have to wait until clinical signs develop. And so for a caregiver, that's very traumatizing because you're telling me that now I have something that may or not progress, and my cat has something that is probably going to be life-ending, and it's hard for the owner because now all you can offer is treating the symptoms of congestive heart failure. And with Felicin CA1, how it actually works is, so hypertrophic cardiomyopathy is, if you think of the heart muscle like a bag of Twizzlers, and all the heart muscle strands are wrapped and they're nice and uniform in the Twizzlers. Hypertrophic cardiomyopathy, due to the pathology that's happening, it's like somebody went in and pulled all those Twizzlers apart and then mashed them back together. The
Really?
Yeah, and so the muscle fibers themselves have an accumulation of all kinds of different cellular debris. There's fibrous formation, and what that can causes is hypertrophy. That the muscle fibers get bigger, and instead of getting bigger and the heart getting massive, it grows internally. And so what it decreases the ability for that left ventricle to fill with blood. And then that causes the secondary conditions like congestive heart failure. What Felicin CA1 does is it helps the heart muscle mediate some of that. It regulates how much and how the cellular debris is removed. And so you see that helps the cells regulate better. And so what all that debris and the weird fibers laying down next to each other actually are, the left ventricular wall becomes thinner because those
Wow.
the fibers and the debris that's inside the muscle cells is removed. And so they're not going to probably ever go back to normal, but it becomes a little bit thinner to allow that ventricular wall to be expand a little bit better.
So the heart muscle is now repaired.
So what we have shown, and that's an important thing. So it is good. This particular product is conditionally approved. So we have shown with a reasonable expectation of effectiveness, this condition in cats is very similar to what they see in humans. And so in the path to approval, we used a lot of human data. And we also did a study in cats. And the cat study that we saw was that it decreased the progression or decreased the thickness of the left ventricular free wall, which is similar to what they saw in humans, which is great. And it was a 6-month study. What now the study that is running in order to help us get to full approval is a very large pivotal study. It's called the HALT study, and it is over a course of a year. So we'll have in a lot more cats, we'll have to be able to make more assertions, like you hopefully be able to make more statements and more conclusions just based on larger cat size as well as over a longer period of time of what actually happens. But what we know now is over 6 months, it does decrease that left ventricular wall thickness.
So you have to be careful what you say. I can say, wow, it cures the heart. And Dr. Davis says, I can't say that, but that's what we see, but we have to prove it over a year's period with more cats because that's the approval process.
And that's what's the great thing about FDA approved products is because, and they have very strict rules when we're
Yes,
developing them. And the FDA doesn't work for pharmaceutical companies, it works for the end consumer. And their primary
right.
job is to make sure that the product that you're administering to your animal is safe and it's effective. And so they hold all pharmaceutical companies to really high standards. And with conditionally approved products, all the safety data has been completed for full approval, which is great. So when you use Felicin CA, when you can feel very comfortable that based on the studies that we have done and we have shown that it is safe for use in your cat, which is great. we are working towards, we have a reasonable expectation of effectiveness, which means that due to the difficult nature in diagnosing this disease and treating it, but this is a very important disease to evaluate. That's how we got approval, is because it meets those expectations, but we used a lot of different parts to get there. But what we're working on now through the HALT study, which is the big pivotal, will be for full approval. So yes, that was a long way of saying, yes, I have to be very careful, but
Right.
it's good. You want me to be careful.
I do. And I want to support you being careful and not saying something that later someone at your company, one of your other vets says, "What? You said what?" No, you said no. She said it. I didn't say it. But the important thing is that for the person living with a 7-year-old ragdoll or a 6-year-old Maine Coon cat, the fact that you've created this drug and that it's safe and that you have every reasonable expectation that it's going to do exactly what you have all put your time, money, and effort into, it's great that it exists. And I think the fact that the FDA says go
Mhm.
ahead and use it because the need is great. And
Mhm.
we share your reasonable expectation that it will work because we've seen it work in humans.
Yes, we do.
Otherwise, we're not going to give you basically a green light to continue down that road.
Correct. And I think as we have launched the product, one of the biggest feedbacks we get from veterinarians is twofold. Number one, they say, we're not seeing it. And I think what we have said is, you know what, but it's seeing you because it's in 1 in 7 cats. But
Yeah.
as those cats age, at 9, it's in 1 in 3 cats. And so when you
Wow.
actually think about it, is when you as a practitioner, are you taking the time to look? And are you listening to these kitties? Is the environment in the room safe for them so that you can really take the
Right.
opportunity? But as caregivers, when that veterinarian says, hey, I really think we need to get some systemic blood work, know that they're not just trying to sell you blood work. There is a reason, because you're by nature, the cat is going to be protective and not show you those clinical signs. Sometimes the only way we can diagnose it is by getting that blood work and to be able to assess it and giving that veterinarian some data so they can be able to make the right decisions clinically. So it's a two-way street. And I think it's just both everybody is, as the rise in cat ownership we have seen in the last few years, that they're no longer just a barn cat or they're just a plus one in your family. There's a significant amount of data that's showing that they're becoming a very strong contributor, if not the most popular pet ownership. And so we as veterinary medicine want to evolve and be better. And so just learning to also take the time to look. One of the things that I think I talked to you about at PMX was just when a veterinarian puts their stethoscope on a kitty, and in this, all clients do it, it's like the trigger for them to
Oh,
talk.
that's right. I remember
You
this.
know what I mean? And everybody does it, whether you're treating horses or cows. It's like as soon as my stethoscope goes down there and I'm ready to listen for the love dub, it's when they want to tell me their life story. And I think in this particular case, what is important for us, both parties, to remember is that with this disease, we want to be able to listen for that heart murmur, and we want to be able to appreciate it, because if they do, depending on the age, depending on the clinical signs, that's often one of the first signals that you're going to pick up on as a veterinarian, that there is something that you need to further investigate. And the gold standard for HCM to diagnose is an echocardiogram to get a view of the heart. But we get there, we have to give either your veterinarian or your cardiologist, depending on what your situation is in the cat's diagnosis, we have to get some basics first to guide that.
Do you think it's possible that your general practitioner vet was not taking this extra amount of time to listen to the lub dub? Besides the fact that the owner, the minute they put the stethoscope, goes, and by the way, I have noticed my cat's poo. And then meanwhile, the vet's trying to listen and listen to the person talking. Do you think that because there was no medication they could offer, that there wasn't the same urgency to diagnose it as soon as possible? Because what are you going to say to the person? This cat is on a banana peel because it's going to get this heart disease. They're all going to get heart disease, or most of them. And there was a shrug. This is what happens with cats. Whereas now that you've developed Felicin CA1, there's actually something that exists that the vet can offer that will stop the progression at the least.
I think it's yes, I think you're absolutely right on the back part of that as far as that when you don't have anything to treat except for when they go into congestive heart failure, you're less likely to it has a downstream effect. I also think that with the pressures that general practices are under with staffing, with timing, with money, with revenue, that appointment times have gotten smaller just to try to be able to meet their needs because and there's so much pressure. And when we talk about staffing, it's kitties have, in order to really get a good physical exam on them, it goes back to what your clinic looks like, how the cats are handled. And so in an average practice, when you're just hurrying, trying to do your very best, it is, I think that we have to be just vulnerable and aware of the pressures that they're on. And it's not anybody's fault. It just is now, though, that we have, it's just the way, unfortunately, is, especially after COVID. But now that we have something to treat it, it's a level set that if you know you have a kitty coming in, what are some changes? What and you know that this is there's potentially, say, the owner rang in and said, hey, my sleeping breathing rate is 25 and I'm a little bit concerned. That's an immediate trigger to that veterinarian that, hey, I need to slow down and take some time. And so I think that communication, to be willing to say, hey, I noticed this, or I heard a podcast about Phyllis and
Yeah,
CA1.
yeah.
And so I think that the more you can communicate and verbalize that, then it's very helpful. But I think there's so many other reasons, I think, on all sides that have gotten us to this point. But I think now with this product, it really lends itself the ability to be like, okay, how do we do better?
And just to be clear for people, you don't take cats and give them heart disease and then study them. I
No.
mean, I think that's important that people think, oh, research, that's horrible and invasive and cruel and painful. You take cats who already have an issue with their heart, and then you give them Felis and CA1, and then you study them with the very fancy ways you do double blind, placebo controlled, etc. Right?
Correct. Yes, ma'am. So I think for many years, people could talk about translational medicine where they've used veterinary medicine to help building drugs for humans.
Yes.
And now in this day and age, we are using a lot of things in human to back translate
Yes.
or translate the other way. It's a two-way street to veterinary medicine because there's so much data that's out there. And this particular drug molecule in human medicine was developed to decrease organ rejection. And they just happened to see that in organ rejection for kidney transplants, it also decreased hypercontractility in the heart. And
Oh my
so
goodness.
the innovation behind it was like, you know what, we have a whole species that has this problem. So let's look at it. But no, we did not cause any diseases, but
Right.
also any heart disease to evaluate it. But also, as we were talking about the reasonable expectation of effectiveness, we used a lot of human stuff to say, human stuff, very professional, very high tech, human data and
Yes.
publications to say, hey, here's where we got the foundation. This is what we built on to look at cats that already had the disease. And this is learning from what we have in human. These are additional studies, especially safety studies, to make sure that when we go into animals that they're going to be okay for chronic use. One of those things is sirolimus, which is the active ingredient in Felicin CA1, is an immunosuppressant. And so what we did is we did a safety study on healthy cats to see if for over a long period of time, if the cats could still mount an immune response with vaccines, because that's very important
Right.
for the kitty population, and they can mount an immune response. So that's good. So a lot of work went in, but I think it's an important topic that you bring up as far as in this day and age, a lot of companies are starting to use things that are inhuman to repurpose. And I think that's what a wonderful time in medicine that
It
we're
is.
starting to veterinary medicine is being elevated from what's being done in human.
You say that so well, Heather Davis. All of you and the vets at PRN are doing such interesting work. I look forward to having you back to discuss some of your other products, but this one is just for cats. And those of you with cats know that cats are the underserved human family members. So thank you for doing that. Thank you to your colleagues. I'm sure that you'll come back when you get that full approval and the double green light, and we can celebrate together. In the meantime, please, all of you, take a video of your cat sleeping. I think this is a great way to bond. And then if it's close to 30 breaths per minute, that's a time to have a conversation with your vet. Heather Davis, thank you so much for being here and for your part in keeping all our animals safe.
Thank you, Tracy, for having me. I appreciate it.